Hi, everybody. Welcome, 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 welcome. I am Dr. Monica J.R. Williams Riley, the owner and lead physician here at Deep Rooted Health and Wellness Med Spa. Thank you for coming tonight. Thank you for tuning in for our conversation on bioidentical hormone replacement in men and women. I'm here to answer some questions. I get requests for us to go live and give some more information. We haven't done one of these in a while, so I was excited about the opportunity to come on these different platforms and give you guys some information of some questions that have been asked of me. So we are live. If you all have any questions, feel free to put them in the chat and they should get to me and I will answer them. We've got quite a few questions that have already come in, and I'm going to address those. Um, and hopefully that answers your questions. If there's additional questions that you have, do not hesitate to put them in the chat, and I would be happy to address them. So, first, I want to tell you a little bit about who I am, what I do. As I said, they call me Dr. Monica. I am Dr. Monica J.R. Williams Riley. I'm an MD. I'm a board certified family medicine physician that specializes in functional medicine. I'm here in my practice here in Lawrenceville, Georgia. And here we do customized wellness plans for our clients. Those wellness plans are to kind of get people back into their wellness state or get them to a wellness state that they haven't been before. By doing this, we do customized plans on nutrition, bioidentical hormone replacement, and really whatever a client needs to understand where their deficits are. And we build a customized plan for that, as well as we introduce new lifestyles to those who otherwise would not have known what the lifestyle that is pertinent for their health individually to be at its best. We also not only work with people who have chronic medical problems, but we work with people who are just interested in having an MD to be their physician and to lead them on their health journey and continue to keep them in a state of health and not always prescribing a pill for that. Being an MD of over 27 years, I guess it's been now, has been an amazing career for me, but I definitely have seen how we have shifted to being so dependent on medications. And so I am here to help people regain their freedom, regain their knowledge of, of exactly how the body works and what we can do to help the body to work at its optimal capacity. So that is what I do. That is who I am. Here, we also do IV nutrition therapy for clients who come in. And you can be a client that takes advantage of all of our services, or you can just be a client that just takes advantage of the different things that we use a la carte, as I like to say. So that would be IV nutrition. That would be the bioidentical hormone therapy. And we are so excited because we have now started our Zen Flow, which is our series where we are having certified instructor in-house, Miss Shonda Floyd Bryant, who is our certified mindfulness, meditation, and yoga instructor, who is here on site every twice a week, Mondays and Wednesdays, except for the last week of the month where it's Mondays and Thursdays. So you all have to join in and come to some classes at our Insight location here in Lawrenceville. So why we came tonight was to learn more about hormones and how they are affecting us, and bioidentical hormones in particular. I really want to delve into bioidentical hormone and really talk about what they are, how they came about, how they're helping, and maybe even discuss some of the controversy that you all have questions about. So let's jump right in. I did get some questions, and so I will kind of use those questions to kind of stem our conversations. But as I said before, do not hesitate to jump in with your own questions, so we can get them answered. So let's go with the first question and I get this question quite a bit. The question is, how long have pellets been around? That's a great question because a lot of people think this is a new fad, especially with all of the people that you hear talking about, the famous stars that you hear talking about bioidentical hormones now. But this is not new. This is not a fad. This has actually been around since 1939, pellets in particular, and they have been around and been effective uh, for quite a long time. 1939 is when pellets were actually introduced, and they were actually introduced because women were undergoing hysterectomies, radical hysterectomies at the time, and bioidentical hormone pelleting was what was used for the therapy following that actual surgery. And so it was very helpful for women to control the symptoms after they had had hysterectomies, which would include, their ovaries being removed, which is where the testosterone and estrogen come from. So don't get confused when people say that this is some kind of new kind of hippie fad that's going on. This has been going on actually far before the hormones that are talked about with conventional medicine came along, which actually came along in 1942. So Premarin came along in 1942, which is the estrogen pharmaceutical that was produced by Wyeth Pharmaceuticals, and it's actually what spiked people's conversation about hormone replacement. But it also was where a lot of the trouble came in for the conversation around biohormone hormone replacement therapy. Excuse me. So hormone replacement therapy is really where the trouble with hormone replacement actually started. And I was a baby doc when we started, really pushing that women definitely need to be on hormones as if it were something like a vitamin that at the age of 50, whether or not, you had signs and symptoms of out of control menopause or not, that you needed to be taking hormones. So I was in residency, I think around this time. And it was confusing to me that we were pushing this for women, and we were not necessarily saying why all women needed to do this, even though women were not necessarily all having symptoms of hot flashes or even vaginal issues with vaginal dryness, because every woman doesn't necessarily struggle through menopause. So, it was questionable to me. And so I, at that point, was interested in other ways that women were really dealing with menopause. And some of the ways that I had used for my patients back then, and used for many, many years up until I started pelleting, was topical solutions that you could buy over the counter. One of my patients, I remember when I was in Houston, Texas, in residency at UT, um, came in and told me what she had been using, which was a topical yam jelly. Yes, yams. So I was very interested and sought out a little bit more information about that, and found out that yams were phytoestrogen, and that you could literally rub them on your skin, the fatty areas of your skin, on your arms or your inner thighs, and that would actually help to get rid of or kind of control hot flashes. So I used that, and then I did some studies into Eastern medicine about other ways that we could use biofeedback. In other words, really working with our mind and body control to help with relaxation, and we call it mindfulness, to really get in front of the symptoms that people were having. So when we did that, we were able to control, for a lot of my clients, the hot flashes, and the topical where it was able to control the vaginal dryness that they were having. So it worked out really well for most people, but some people obviously still were having difficulty with it if they weren't able to grasp either one of these therapeutic concepts. And then the studies came out and showed that, hey, taking hormones, synthetic hormones, really could be related or connected to cancer. And so everybody pulled back. And I was like, yeah, that makes a lot of sense that we should be really more conservative about what's going on. But then I was still using the synthetic hormones for women who were requesting it, But I really would try to talk my patients into trying at least um, the more natural solutions. And a lot of women really had the success with that. And so I hadn't used synthetics. I hadn't prescribed synthetics for women most of my career because I would really, really put a lot of energy and education into the others. So that's the history. 1942 is when the Premarin came around, but 1939 is when the bioidentical hormone pellets actually were born and had not really ever gone out of favor. Those who were using them, who knew about them, continued to use them, but we just weren't hearing about it in the news. Okay, so the next question I got was, who is a person that should get hormone replacement? And so I will say to you, pellets are really a great solution for men and women. Now, I've talked a little bit about women, but I do not want to leave men out of this conversation. Know that men go through a similar time of life called andropause. Andropause kind of is the sister or the brother to menopause. So at the age of 40, men and women begin to have a decrease in those hormones, estrogen and testosterone. And when we do, it's a normal phase of aging. I don't want anybody to think that we're talking about a disease process because we're not. It's a normal phase of aging. And but some people, when they're going through this normal phase of aging, actually have a more difficult time. We speak about it a lot with women, but not so much with men. So, who should get bioidentical hormone therapy? Anyone who is having difficulty with the signs and symptoms of hormone depletion or hormone imbalance. So, what are those signs and symptoms? Those signs and symptoms are, for women, a lot of times you have the hot flashes. A lot of times you'll have the night sweats. Sometimes you'll have vaginal dryness. But what we see across the board for men and women that is the reason why testosterone is both important for men and women is that we'll see something called brain fog. Brain fog is when you have a memory, but it's a very foggy memory, meaning that you may not be able to remember numbers, you may not be able to remember tasks like you used to. So I'll tell you my story. So my story and how I got hooked into bioidentical hormones for me personally, because I do get pelleted myself, is that it was right around COVID, and I was working kind of front line for my clinic because we had to let a lot of employees go, and most of the practitioners had to kind of go as well. So there was a lot of stress, and I was a medical director and was really seeing a lot of people who were struggling with COVID. We were doing a lot smaller staffing. My workload was increasing, and just the stress of just being in the pandemic. And so I started to notice that I was not able to read numbers and hold on to them as well. I'd be turning back and forth when I was trying to compose different reports, and I couldn't remember phone numbers, and it was very frustrating. Now, I did not know, even as an MD, I did not know that this was related to my hormones being imbalanced. I actually had a hysterectomy when I was 40. And so I didn't, because I wasn't having any issues with like serious hot flashes at the time or anything like that, I really wasn't thinking that I was going through menopause because I was doing good otherwise. But upon me testing out myself on getting pelleted, because I was really interested in, after I found out the more information about it, I found that my brain fog, my foggy little brain, was was absolutely resolving after being pelleted. It was life saving for me. It was life changing because had I kept going down that road, I probably would not be sitting here in this seat today because I probably would have been trying to retire somewhere. That's how devastating and how much it consumed me that it took me so much longer to do my work. So, if you're having brain fog, if you're having low libido, that's sex drive. If your partner may want to be intimate but you don't want to be intimate, your partner may be, boom, boom, ready to go, and you just not at all ready to go. That's libido. And that could be men or women. That's the thing about it. We always think about the woman being the one, but you men out there, that can be you too. So just wanting to be a couch potato, not really interested in that super fine woman that you got sitting there, or anything. If your other partner, you have a male partner and you're just not interested in engaging, regardless, there is no limitation on gender. Whatever you feel is your kind of baseline libido that has dropped, that can be your hormones. That can be your testosterone levels, really dropping down so that you don't feel like being interested, being involved. Estrogen for women also has an impact on their vaginal dryness. And so that's another sign. So if your libido with your testosterone is low and you don't feel like having sex, and then where estrogen is low too, and you have sex, but it's painful because you're having vaginal dryness, not a good combination for a healthy, active, vibrant sex life. Now, other things that can be seen as far as symptoms are concerned are maybe you work out. Maybe you don't feel like working out because you don't have the energy. That is another sign. But also, maybe you work out and you feel like working out, or you make yourself work out, and then you don't see any gains. You don't really see any definition. And this is for women as well as men. So, what testosterone does is help encourage lean muscle mass, not like Arnold Schwarzenegger muscle mass, but just definition, so that when you're doing the cardiovascular, when you're doing the weights, you actually get to see the benefits of them, not just going to the gym, spinning your wheels, and then not seeing any kind of results. So it will also help with that. So, sleep is another area. Sleep is an area for those who understand about recovery. If you're not sleeping well, then guess what? You will not feel well. You will not perform well. Your memory fog, your brain fog will be even worse. Your gym workouts won't be as efficient. So, it's really, really important that you not only work actively during the day, but that you sleep well at night. And having hormone imbalance, testosterone in particular as well, can lead to you not having a restful night's sleep or even insomnia. And so that's another reason why someone should have hormone replacement and be evaluated for it. Another thing that I find in clients, they'll come to me for, so they have the insomnia, they have the maybe the hot flashes, or they have the low libido, but then they also may have none of those, but just have anxiety. Now, this is anxiety that they may not have had before, may not have had either anxiety attacks, or may not have had depression before. And this can be a sign of hormone imbalance. A hormone imbalance will cause you to be off kilter. It'll cause you to go to the doctor and ask them for something to help out with this. And you may find that the doctor writes you a nice little prescription for a medication like Xanax, or, an SSRI. But the truth of the matter is, it's just your hormones. And the blessing is that if we balance hormones, you can be off of those medicines. I have plenty of clientele that actually get off of medicines for those things because their hormones are balanced. So it is that important. It's that important. Now, there are benefits for, bone health. There are benefits for heart health as well. There are benefits even for prevention of cancer, which doesn't get talked about enough as well. These are very, very important. And I have done a few interviews recently about the heart benefits for people not suffering through menopause and having more autonomic systems symptoms that are actually have been shown in studies to actually lead to cardiovascular disease, especially in women of color, because we tend to have longer bouts of menopause symptoms as well as earlier bouts of that. And so that'll be another presentation that I will do, but I have definitely been speaking out more and more about this, and have been in some news articles and some interviews, and will be on some podcasts about that as well. So Let's see. Another question that I was asked. Um, when you get pelleted, how does that work? So how bioidentical hormone pelleting works is that when you get pelleted, we introduce in a small local area on your backs, on right above your buttocks, or your, I should say, right below your belt line, and right there at your buttocks in the fatty area, right, not where you're sitting, but above that. We introduce a little local numbing medication, and then from the local numbing medication, we are able to then insert a pellet, which is like the size of a rice grain, underneath the skin. Now, when we do that, we are bypassing your liver so that the blood supply is directly affected. Within 24 hours, the new blood vessels are actually start to form around the pellet, and that actually allows the pellets estrogen and and estradiol, excuse me, and the testosterone to be absorbed into the bloodstream, and that's it. We don't use a stitch. We don't, do have any big, incision point there. It's really about probably about a centimeter or less, that the area that we actually puncture, and then we use a steri strip to close that area up, and that area you protect for 3 days. Protect meaning no lower extremity exercise, no running, no pelotoning, those kind of things that would engage the muscles back there. Why? Because we want that area to heal, because I'm not putting a stitch in it. And we cover it with a waterproof bandage so that you're able to shower. Now, you are not allowed to have a pool, get in the pool, or have any soaking baths or hot tubs, because we want to keep that area dry. And you are able to at least take a shower. And the more you move around with the pellet after those 3 days, the better the blood supply, the better the engagement with that pellet, that seep it into the blood. That's going to happen even better. And so we encourage cardiac output. We encourage you to move around. We encourage you to exercise, because this helps those hormones dissolve from the pellet itself into the bloodstream. Let's see. Another question I got was, what are the pellets made of? Great question. So pellets are the estradiol and the testosterone. They are derived from actually fruits and vegetables. So they are usually derived from a yam, or they are derived from soy. And a lot of people ask about the soy portion, because if they're derived from soy, am I going to have allergic reaction? And the soy is actually not the active ingredient that causes people to have allergic reactions. So there's different parts of substances that actually trigger allergic reactions, more than likely the protein part. But this is actually not. It's the actual bond in the yam or the soy that does not stimulate allergic reactions. So that's really important and really helpful, because you're putting into the body something that comes from the earth. And that's why the body responds to it. And that's why we are able to call it bioidentical, because what's in the yam and what's in the soy looks more like the estradiol testosterone chemical bonding that we have naturally, that we naturally produce. So that's why that works well for our body to recognize, and it's not a foreign substance that we've come up with in the lab. Although the bioidentical hormone pellets are actually compounded in the pharmacy, at a compounding pharmacy. We here at Deep Rooted Health, we use a compounding pharmacy that we've been using over the last 3 years, and it has been really consistent. They do a lot of testing to make sure that they're consistent. And the beautiful thing about bioidentical pelleting, hormone pelleting, is that we are able to really customize the dosing. Synthetic hormones is kind of like a one-stop shop. Most people all get the same dosage of their Premarin, or even their testosterone. They're pretty standard. So the difference is that we actually calculate that out based on your symptoms, based on your risk, based on your your lab work to see whether or not you're qualified. And we put all that information together to calculate exactly what, and your symptoms, of course, I missed that one, what works best for you and why one dosage would work better for you. And we check back in with you to see if that dosage is working for you. And if it's not, then we can tweak it a little bit to customize it to get what we need out of it. So pellets are great because they are very much the healthiest way to maintain a balanced hormone, optimized hormone level for you and me. So that's the reason that we do it, and that is what they are made of. They do have sometimes a bonding or something to keep the pellet together. Stearic acid, a lot of times, is the thing that's used to keep them together. And most people are not allergic to stearic acid. It's kind of the same ingredients. If you ever had an aspirin, that's the same ingredient that would be in an aspirin to keep them together. All right, another question. Um, how big are the pellets? As I alluded to before, excuse me, pellets are about the size of a rice grain. So they're very small. They just vary in length based on what the dosage of the actual pellet is. So that is the length of them. And know that they are being totally absorbed into your body. So if they are, there's nothing to take out. So once we put the little rice grains in, over the process of 3 months, they usually get they'll get dissolved into your bloodstream, and when it's time to repel it again, you're not going back into that same location. We just move locations and just kind of rotate, but they're not there anymore. They're all gone. You've used them up. All right. Let me see if I have any questions before I go on my list that I've already had and see anybody else has asked anything on our other channels. And you guys keep the questions coming. These are great. All right. So while this is pulling up, oh, someone asked about time released. Are the pellets time released? And the time released action happens, as I was saying before, by the actual pellets themselves being absorbed into the bloodstream. So they're not time released as far as they having like a coating on it. They actually get stimulated by your activity. Yes, by your cardiac output. So that is why I always encourage my clients to get out and exercise. The more cardiac output, the more that blood gets pumping, the more your blood flows, the better your pellets are going to work. So, people ask me all the time, "Oh, I want to get pelleted. Can I lose weight?" Well, what pellets are going to do is give you energy. Pellets are going to give you that stamina back. And that means that you get to use that stamina to go and exercise. And it doesn't matter, like whatever exercise works best for you. So if you're a runner, then you go run. If you play tennis, go play tennis. If you like Pilates, go do Pilates. If you like yoga, go do yoga. All these are exercises that get your heart pumping. And that's what the pellets need. So don't feel like you've got to go join a gym to get benefit. You just have to be moving, and you just have to be doing your thing, the thing that comes to you as your healthy movement. And when you do that, guess what? The pellets start to rotate around the body in the bloodstream, and they actually start to go to the different areas of your body that are stimulated by having hormones. So that's skin, that's hair, that is your heart, that is your bones. So all these areas that are stimulated and your muscles, because you have an optimized level of hormones now, get the benefit. But you got to get moving, because if you sit on the couch, that's not going to help that bloodstream move around those pellets and get that estradiol and the testosterone moving with it. So I got to get you up and moving, and I always encourage my clients to do that. Okay, so let's see here. No, pellets are not. They are not covered by insurance. But here at Deep Rooted, if you have insurance, we are able to let you use your insurance for your lab work. So know that is a possibility. And then but the actual pelleting itself is not covered. I have a question for, okay. So it's saying that the chat is disabled for the live stream. Let me see. Um, Can you guys see anything on the chat now? Let's see. So if you go into the Facebook page, you should be able to put your questions in live. These are questions I got beforehand. I hear you, Cinta. I thank you for tuning in. We have a lot of people on, and let me see if I can get your comments. I can see if I can get your comments on. I'll try to go through. Since I can't get it this way, I'll try to pick them up from the actual site itself. All right. All right. I apologize for that, you guys. I had so many good questions from earlier. Okay. Well, let's go with the questions that I have, and I'll be trying to pick up any other additional questions that you have. Um, someone asked, what about after the insertion? What should they expect? So, what you should expect is that the first 24 to 48 hours after the pelleting, um, it will cause you to actually increase your peaceful or restful sleep. So, with the peaceful or restful sleep, you will kind of feel like if you didn't have insomnia, you still will have a more kind of deeper sleep. And that's actually really goes far with the recovery. So, peaceful and restful sleep helps you to have more energy. Peaceful and restful sleep helps you to lose weight, because a lot of people don't realize is when your sleep is disrupted, or when your sleep is not full and your REM is not, you're not in that REM sleep for a sufficient enough time, your body doesn't get to recover. So I will say to you that that's the first thing that most of my clients will give me feedback on, is that they have a great night's sleep within the first 24 to 48 hours. After that, some of the other symptoms that you will find will kind of slowly begin to filter in. And so usually we do repeat blood work at about a month and a half. And at that point, we're able to kind of check back in with you, see how you're doing, and see how the symptoms that you had, how you're responding to it, but also checking on those hormone levels to show you exactly where we kind of hit on your estrogen level as well as your testosterone level, and to make sure that we don't need to tweak it just a bit to get you to the place that you want to be. All right. So it looks like um, YouTube, everybody is doing well on YouTube, and I'm not sure if anyone is on the Facebook. Let's see, are you all able to go live on the Facebook? Just checking on you all to see, and hopefully you all were able to see the link. But don't worry, if you all are not able to see us on Facebook, I will post this on Facebook so that you all will be able to go back and see it. And any questions that you post, I will go back and answer. So if I don't get to your question to right now, no worries. I will actually be able to get to you on get to your questions when you post them. I will answer every single one of them. Okay, so we talked about the actual procedure. We talked about what happens afterwards. For women, the pelleting that I do with the bioidentical hormones lasts for about 3 to 4 months. For men, it lasts for 6 months. So that means that men are getting pelleted twice a year, whereas women are getting pelleted about 4 times a year. That being said, know that we're putting different amounts of hormone in for women and men. And so that's the reason why women have to get theirs re-upped before. Right, great. I just see Ted. Thank you for showing up and letting us know that we can see you. And I just saw your question come up. So great. I want you to understand that when I do give women testosterone, it is not at the same level that men get testosterone. So a lot of times people are concerned that women are going to become these big hulks. They are not at the same level. So that's why women, we get smaller amounts, we get them more frequently. Men get larger amounts less frequently, so that we can more so mimic what the body is actually doing. We have no wants to masculinize women. We just want to make you your optimized and strongest self. And women need muscle mass, and they need that for their bone health as well. So it is important. Women do have testosterone levels, although conventionally we don't talk about it, nor do we measure it. And likewise, men also have estrogen levels. So estrogen levels also are something that we don't talk about in men. Testosterone gets converted to estrogen in both men and women. So that is important to understand that both sexes do have estrogen levels, and they're important for both sexes. And testosterone is important for both sexes as well. All right. I think we've answered a lot of the questions. I'm going to see if I can find any additional questions that have come up. You guys asked a lot of great questions. Thank you for sending your questions in. Let's see here. We'll go out and see if there's anything on YouTube. All right. All right. I think we've answered them all. Okay. All right. Well, if there aren't any more questions, I want to give you guys some information. If you are interested in talking further, um, okay, have you had any issues with allergies? So we talked a little bit about that before, and allergies are really a very minimal response that we have because these are coming from plants. Although I tell people you can be allergic to anything, we have a minimum response to the pellets as far as allergies are concerned. As I said, the pellets are derived from yams and from soy, and it's from the ingredient, the compound that actually causes the stimulation of the estrogen and testosterone receptors, but not the proteins that cause allergens, because those are really the things that actually, regardless of what it is, cause an allergic reaction, is the protein in a substance. So when they derive out or the substance, the active ingredient for the pellets to actually for the hormone receptors, they actually do not use the portion that would cause allergic reactions. So I have not had anyone in my practice who has had, an allergic reaction to the pellets themselves. But once again, anyone can be allergic to anything, but the way that they're compounded has a very low likelihood of that happening. Thank you for that question. Great question. Now, what I do want to do is, I know that, sometimes people have questions that'll come up later. So here at Deep Rooted Health and Wellness Med Spa, I make myself available for free 15-minute consultations. So I would like for you all, for those of you all who have had questions or think that you're interested in getting pelleted, to come and have a free consultation with me online. It's on a phone consultation, and that way you can get your questions answered. And if everything I can answer all your questions, and if you're interested, we can get you booked straight from there to get you set up. So you can call our office. Our office number is 770-847-8104. That's 770-847-8104. And you can call and request to get a 15-minute consultation. Also, you can go on our website. Our website address is www.deeprootedhealth.org. That's www.deeprootedhealth.org. And if you go on there, you will get the opportunity. There'll be a pop-up. And if you put your name and your information in there, we'll get back to you and we'll get you set up for a 15-minute free 15-minute consultation. Or you can go to book online in the website. And one of the options that you have is to book your own free 15-minute consultation. That way you can get your questions answered and kind of find out if this is right for you. Now, if you already know that you are going through menopause and or andropause, and you know that this is right for you, or you believe that it is, and you're ready to get started, you're ready to get started with your lab work so we can make sure that your labs are where they need to be for you to get the most benefit out of this, then call us at the office, 770-847-8104. Or you can go online and you can actually book your bioidentical hormone pelleting. If you book your pelleting, give us someone will give you a call, or I would say to you, call to confirm that you have the lab work, because if the lab work is not done before you book your appointment, then you'll show up and it's no time. We don't have any numbers. So we want to make sure that you have the proper lab work. I will take lab work from your own physician as well. But we do need to make sure that you have the proper lab work for our evaluation. We can do a consultation for your lab work prior to, if you're still interested to see whether or not you're a good candidate, or if you know that this is something that you are exhibiting these symptoms and you know that you're ready for this, we can do your consultation for lab work inside of your appointment on the day of pelleting. Well, you guys, thank you so much for joining me tonight. This has been a lot of fun. I have been asked to do one of these for a while. It's been a minute. And so I was excited to have the opportunity to jump on with you and to share some information about bioidentical hormones. This can be a life-changing um, procedure for a lot of people. And for my clientele, I have testimonies of how it has really changed their quality of life. So if this is something that you think that you're interested in, whether you be a female or a male, you want to bring the vibrance back to your life, you want to bring the va-va-va-voom, as I like to call it, please do not hesitate to give us a call or go on our website. I'm looking forward to hearing from you all soon. Have a great night and see you in the office. Be well. Have a deep rooted night.